Okay, let's unpack this. We often talk about how time-sensitive stroke treatment is, but today we're doing a deep dive into a Stanford breakthrough, something that really tackles the stubborn limitations of current treatments head-on. We've got some really fascinating sources here detailing a new technology for blood clots, the kind that cause strokes. So our mission today for you is to explore how this thing actually works, its potential impact on patients, and honestly, the really surprising way it even came about.
And it's so critical. When we talk about ischemic strokes, that's where a clot is blocking blood flow to the brain. Speed is just everything. Every single minute counts. Seriously, the faster you remove that blockage, the more brain you save. It directly impacts, long-term recovery. But as we're about to see, the tools we have now, they don't always cut it.
Yeah, that's the core problem, isn't it? With the current ways we treat these strokes. The success rates are just, well, they're not great. I mean, getting the clot out on the very first try, it only happens about half the time with existing methods.
Sure.
And maybe even more worrying, around 15% of the time, they fail completely.
Right. And you have to ask why. Why do they struggle so much, especially when every second matters? Well, it really comes down to the clot itself. Blood clots, they're held together by these incredibly strong, stringy proteins, fibrin. So current tools, they usually try to vacuum the clot out or maybe snare it with a kind of wire cage. But the problem is that force can snap those fibrin threads. And when that happens, little bits break off. They can travel further down into smaller blood vessels, making it much, much harder to get them out later, sometimes impossible. That 15% failure rate, that's what that means in an emergency. Real people, devastating outcomes.
So wait, are you saying the tools we use now can sometimes actually make things worse by breaking up the clot?
Uh, in a way, yeah. They can inadvertently fragment it. You solve one big problem, maybe, but create several smaller, harder to reach ones. And that's exactly why this new Stanford tech, the Milli-Spinner thrombectomy, is potentially such a big deal.
Okay, the Milli-Spinner. Developed by Jeremy Height and Renee Zhao, findings just out, June 4th in Nature. And they're suggesting it could dramatically improve success rates, not just for strokes, right? But maybe heart attacks, pulmonary embolisms too.
Exactly. And what really makes it different is the whole approach. Renee Zhao, one of the researchers, she put it perfectly. It's unique because it uses, and I'm quoting here, compression and shear forces to shrink the entire clot, reducing the volume without causing rupture.
Yeah.
That's the key innovation. It doesn't rip it, it compacts it.
Okay, now this is where it gets really interesting, the design itself. So picture a long hollow tube, kind of like current catheters, right, inserted into the blood vessel. But the clever bit is this tube can spin really, really fast. And it has these special fins and slits on it. And these aren't just decorative. They create this focused suction right near the clot.
Yes, that localized suction is key. It starts the whole process. And the mechanics are pretty fascinating. Think about like a loose ball of cotton fibers, or maybe a clump of hair from a brush. If you press it between your palms, that's compression, and then rub your hands in a circle, that's shear, the fibers get all tangled up into a much smaller, denser ball.
Uh-huh. Okay, I can picture that.
So the Milli-Spinner does basically that to the fibrin threads in the clot. The suction holds the clot, the spinning creates the shear, and this process tangles and compacts those fibrin threads without breaking them. It makes the clot denser, smaller. It also kind of shakes loose the red blood cells trapped inside, letting blood flow past easier. And then this tiny, dense little fibrin ball, it can just be safely sucked out through the tube. They've seen it shrink clots down to 5% of their original size.
5%. Wow. So it's
Uh,
like controlled shrinking inside the blood vessel itself. That's quite something.
Okay.
And the results, you mentioned they're good, but how good?
Oh, they're phenomenal. Jeremy Height said, for most cases, we're more than doubling the efficacy of current technology.
Doubling efficacy for most
Oh,
cases.
nice.
That's huge. What kind of impact could that have?
It could be absolutely transformative. Think about those really difficult clots, the tough, fibrin-rich ones.
Wow.
Right now, current devices, they only get those out successfully first time about, 11% of the time. It's really low. The Milli-Spinner, they're hitting a 90% first try success rate with those same tough clots.
90% from 11.
90%, yeah. As Renee Zhao said, it works so well for a wide range of clot compositions and sizes, even the ones that stump current tools. Going from 11% to 90%, that's not just better, it's a whole different ballgame in an emergency. It means fewer attempts, faster procedures, and, a much, much better chance of a good recovery for the patient.
It's always amazing how these big breakthroughs pop up from unexpected places, isn't it? How does this one even start?
Yeah, this story is really cool. The Milli-Spinner design, it's actually built on Renee Zhao's earlier work. She works on Milli robots.
Milli robots, like tiny robots.
Exactly. Tiny origami-based robots that were originally designed for, like, swimming through the body, propulsion.
Mhm.
This spinning cube with the fins and slits, that was first thought up as a way to move those little robots around. But then, almost by accident, they noticed it was also creating this weirdly strong, localized suction. So they thought, let's just try it on a clot, see what happens. And that's when they saw it. This striking clot color change from red to white, and the volume shrank dramatically. She said it felt like magic at first because they didn't immediately grasp the full mechanics. So yeah, from that kind of chance observation, they figured it out and refined it. A propulsion idea turned into a clot buster.
Wow, that's some pivot. From moving robots to shrinking clots. Okay, so clearly it's a potential game changer for blood clots. But breakthroughs like this often have wider uses. Are they looking beyond clots? What else might this be used for?
That's a great question. And yes, they are definitely thinking bigger. I mean, the immediate goal is blood clots, obviously,
Yeah.
because the need is so urgent. But they're already working on an untethered version, one that could, swim freely through blood vessels on its own.
Untethered, wow.
Yeah, to potentially target clots anywhere. Beyond that, they're exploring things like capturing kidney stone fragments. And Zhao even hinted there might be uses completely outside of medicine, too. This core idea, this mechanical principle, it seems pretty versatile.
So wrapping this up then, what does this really mean? For you listening, for patients, this isn't just a small step. It feels like a potential sea change, right? A major shift in what doctors can do. It could drastically improve the chances of helping people during a stroke, a heart attack, potentially saving lives, preventing serious disability by getting that blood flowing again better and faster than before.
Absolutely. And you can tell the researchers are really pushing to get this approved for patients as soon as they possibly can. Its unique ability, the way it actively reshapes and shrinks the clot instead of just yanking at it. That's a fundamentally new approach to a problem that's, frankly, haunted emergency medicine for a long time.
What an incredible story. A huge leap forward, potentially, and from such an unexpected starting point.
And maybe that's the thought to leave you with. Considering how this device, born from research into tiny swimming robots, ended up potentially revolutionizing clot treatment, really makes you wonder, doesn't it? What other life-changing breakthroughs might be hiding inside technologies we already have? Just sitting there, waiting for someone to look at them a different way, make an unexpected connection, and unlock a potential we never even imagined.